The long journey for the cruise ship at the heart of the Hantavirus outbreak has finally reached its final port. The MV Hondius has docked at the Dutch port of Rotterdam. That vessel will now be disinfected and undergo a deep clean. People wearing hazardous materials suits made their way onto the ship today. The Hantavirus outbreak on board has resulted in at least 10 infections worldwide. 3 people have died. The ship's remaining crew members and medical staff will now enter immediate quarantine, while the body of a German national who died of the virus remains on board. Members of the media were taken by boat to see the ship up close as it pulled in. Will Denslow was among them.
Really, this was an opportunity for our boat to really be going alongside the Hondius as it was arriving here into the port of Rotterdam. As we were travelling alongside them, we were with the boat for around an hour or so. We could see people on board wearing masks, and then as part of the disembarking phase, we saw ships coming on, tethering the boat as it really makes landfall, as it stays here for its resting place. You mentioned that deep cleaning that will now happen next, as well as taking care of the roughly 25 members of the crew that remained on board. Of course, this is not the first time that it has docked since this hantavirus outbreak emerged. The majority of those on board, the passengers, disembarked in Tenerife about a week or so ago. This is the busiest port in Europe. It has been a number of days of keen logistical coordination to make sure that everything goes as smoothly as possible.
Has there been concern there in the Netherlands about this ship returning to Rotterdam?
Given the nature of this story, the nature of this virus, there are, of course, huge concerns for the general public. But what we've been hearing from health officials that were on board the boat with us, speaking to the media, saying that there is really no reason for the public to be concerned. They say they're taking every possible measure to ensure that there'll be no risk to the wider public. They say that those on board have been subject to testing. They will go into mobile homes right off the pier where the ship docked, where they'll be in these homes for several more weeks until they've reached their 6 weeks of quarantine, where then they'll be continually tested. Once cleared, they'll then be allowed to go off to their final destination. So really an overarching message from health officials that all steps are being taken to make sure the public at large will be as safe as possible.
That is Will Denslow in Rotterdam. Canada has now confirmed its first case of hantavirus linked to the deadly cruise ship outbreak in the Atlantic. Public health officials in this country say the overall risk remains low, but several Canadians are still being monitored closely.
We know every single person who has been exposed on that cruise ship. We have a list of the names across the world. And if we have good public health follow-up, good quarantining, good infrastructure for testing and so on, we should be able to handle that.
The Public Health Agency of Canada says a Yukon resident now isolating in British Columbia has tested positive for the Andes strain of hantavirus. The patient was hospitalized last week with mild symptoms, including fever and headache. Their traveling partner has tested negative at this point. 3 of the 4 Canadians evacuated from the MV Hondius are now in hospital, the last still isolating at home. The outbreak has now been linked to at least 10 cases worldwide and 3 deaths. Let's bring in Dr. Christopher Labos, epidemiologist and cardiologist. Dr. Labos, good morning to you.
Good morning.
Okay, we have one person who is tested positive. What kind of treatment would they potentially be getting?
So there is no actual treatment for hantavirus. What you're basically doing is treating symptoms and supporting somebody so they can ride it out. So it could be as simple as giving them Tylenol and fluids if they don't have much of an appetite. It's only later if somebody develops the serious complications of hantavirus, the cardiopulmonary syndrome where your lungs fill with water, that you might need to be intubated, put in the ICU, or put even on a heart lung machine if your blood pressure is dropping a lot. So it's really supportive care. It's keeping the patient alive until they can clear the virus from their system and eventually recover.
That virus is very often contained in the feces of rodents, mice, for instance. We got a question from a viewer, Florence, who asked, how long does the virus remain active in the feces of a rodent?
It kind of depends on the environmental conditions. So let's say 1 to 2 weeks. If it's outdoors exposed to sunlight, it's probably not going to last very long. It could be as little as, lasting a few hours to a day. But if it's indoors in a damp, cool environment where rats and other rodents tend to leave their feces and tend to sort of cluster during the winter months, that's where it can last for an extended period of time. So that sort of time range, more or less, let's say 1 to 2 weeks to be safe.
There is not a vaccine for hantavirus right now. Is anybody working on one?
Well, people are always working on vaccines. It's always a question of funding and resources, and it's a question of being able to test the vaccine. Because hantavirus is not that common, at least in our part of the world, actually testing a vaccine would be very difficult because you're not going to have enough cases to see if it works. You can always use animal models to get a good idea of whether something is going to generate an immune response, but the actual mechanics and resources to do a large clinical trial is always going to be a bit limiting. But the short answer to your question is yes, people are always working on these sorts of things.
So we have another question from a viewer, Cheryl, who said the COVID-19 pandemic spread quickly, she says, because of air travel. Could this happen again with hantavirus because of the fact that there were 22 different nationalities on board that ship?
I mean, probably no, for sort of a very important reason is that these two viruses, COVID and hantavirus, are spread very differently. Because COVID was airborne and because with air travel, you had a bunch of people in a plane all breathing the same air for hours at a time. That's why you started to get a lot of cases and a lot of very easy spread across international borders. I mean, international spread is still an issue with hantavirus, but it does tend to need this sort of very prolonged close contact for it to spread from person to person. It is not a common event. And so international travel is making the international response a lot more quickly because now you're having to track people across international borders to do the contact tracing, to inform them that they need to self-isolate. But the international travel itself is probably not going to be as big a driver as it was during the COVID-19 pandemic.
And it is fair to say that COVID is more easily transmissible than hantavirus is when you're in close contact.
Absolutely, absolutely true.
Dr. Labowitz, this is all coming on a day that the WHO is warning the world is falling behind on being prepared for infectious diseases, potentially for another pandemic. What does that mean if we see one?
Here's the thing. I think a lot of people believe that there's this glass case somewhere in the halls of government that says break glass in case of emergency, and that we have a plan ready to go in place for how to deal with stuff. And I think what the WHO is signaling is that we don't really have an international plan. Like even this current situation with hantavirus, which was relatively straightforward and relatively small scale, at least compared to COVID, it still posed a lot of logistical difficulties. We are not great at international coordination. We are not great at pooling resources. We are not great at having a clear plan of what to do if X, Y, and Z happens. And so I think what they're signaling is it's all well and good to look after your own population, your own borders, but we have to realize is that infectious diseases do tend to become international events, and we can no longer think about a local response. We need to think about a global response in terms of vaccine sharing when that's necessary, sharing medical resources when that becomes necessary, and having a clear plan for what to do if a new virus or disease happens to emerge at some point in the future.
Yeah, we're certainly seeing that internationalization. When we talk about hantavirus, I wouldn't want to overplay the hand. There's not a huge number of people who are infected, as awful as it is for the 3 people who have died and the others who are now dealing with this illness. It's not widespread. One thing, though, that is widespread, very often we're dealing with health issues, is misinformation. It's a big concern during COVID. What do you think we ought to take that we should apply in this moment?
Well, I think that's another issue, too, that requires an international response, especially during COVID and with, unfortunately, every health crisis. You see a lot of misinformation out there that you can use ivermectin to treat hantavirus, and stuff tends to get recycled from one epidemic to the next. And I think that, too, makes a case for sort of international cooperation, because a lot of people would say, well, why in Canada do you have to isolate for 45 days, whereas in the US you only have to isolate for 21 days? Nobody knows what they're talking about, therefore I'm going to tune out. And so not having a coordinated response and sort of a uniform response across the planet makes it easier for people to find gaps in the response and to therefore seed doubt amongst the population. So if everybody was able to sing from the same hymn book, as it were. It would make things a little bit easier, because then we wouldn't have these conflicting messages going to the population. Because again, we might think that people are listening to their governments and their own public health officials, but because everything is on the internet, people are hearing different messages from different countries, and that just makes it confusing. And in confusion, that's when you start to breed chaos.
Dr. Labos, thank you.
My pleasure. You take care.